Pregnancy is a wonderful opportunity for any woman to take a look at her overall health. And oral health, the health of your mouth and your teeth and your gums, is a critical part of your overall health.
It's important that when a mom either is planning on becoming pregnant or knows she's pregnant, to see a dentist immediately to determine their oral health status.
It's very, very important that a pregnant woman stays on top of her oral home care with the brushing and rinsing, flossing properly every day.
They gave me a chart of what I needed to do because I'm a first-time mom and I didn't know what to do with my child, and I was like worried what I'm going to do, what am I supposed to do. So she told me everything that I needed to know about taking care of my teeth and taking care of my child's teeth.
Well, Jaleisha, I'm so glad you're here, and your baby is just so beautiful.
Thank you.
We're going to take this time to go over how to clean your baby's mouth. Then you're going to show me how to do it when you come home. Would you like that? You're talking. This is good. We're going to put her on my lap.
Okay.
And with her head facing you, her face facing you, and you're going to hold her hands.
Okay.
Thank you very much. And I'm going to lift her lip and start on one side. You see that? And go to the other side.
Mm-hmm.
And then on the bottom. And I'll go around to the other side. And she's doing really well. Sometimes they get a little fussy. We're going to do her tongue. Can we get her tongue? She's biting down, thinking that this is part of her milk. We do this because the baby gets used to having something in their mouth.
Mm-hmm.
And also you're able to clean all of the leftovers of milk and other things when she grows up a little bit, but she just did a perfect job. So I would say to her, good job. Such a good baby. So show me how you do it when you're at home.
When I'm at home, I gently play with her bottom lip so she can open up her mouth. Then I gently go across the bottom, around. Then I make sure I do the top just how I did the bottom. Cross, under, so I can get the gums. Then I get on her tongue, wipe around gently. There we go. And that's how I do it when I'm home.
Such a fabulous job. You did a better job than I did.
Thank you.
So wonderful. One of the reasons that we're working so closely together to prevent tooth decay and make sure that all moms have this information and can prevent this disease for their children is because the disease itself causes pain. It costs a lot of money to treat. It prevents children from learning, and it is something that we can prevent.
A lot of people, I guess, don't realize that when you become pregnant, you are more susceptible to diseases, just like the elderly and the infants.
There's been an association between periodontal disease and low birth weight babies, and there is also a strong association between mothers having active tooth decay and passing on bacteria to their children. Tooth decay is an infectious disease. It's a process where children have received bacteria from a parent or caregiver, and that bacteria eats sugar. And any kind of sugar that you consume, whether it's natural or artificial, is turned into acid. And acid actually removes the mineral content of teeth, which then results in what we call a cavity. Tooth decay is not a family trait. Unfortunately, what happens is that children adopt the behaviors of the people that are taking care of them. And it's important to know that children are not destined to have tooth decay. If you can prevent the use of sugars in juices and soda early in age by having good oral hygiene, by brushing twice a day with a fluoride toothpaste, you can actually reduce the risk of tooth decay dramatically. So we've talked about brushing your teeth twice a day with a fluoride toothpaste. The other thing we want to make sure of is, because you don't have fluoride in your drinking water, we want to make sure that she's taking a fluoride supplement. And we're going to write you a prescription for a fluoride supplement. And what she's going to do is she's going to actually chew this tablet. We don't want her to swallow it whole. We want her to chew it so the little bits of the tablet get in her teeth. And you're going to do that every single day. The reason that fluoride is important is because fluoride helps strengthen the tooth structure. It helps put minerals back into the tooth and helps prevent tooth decay. The earliest sign of tooth decay to a parent is a white line or a white dot on a tooth. When a tooth starts losing mineral content, it actually gets bleached in color. So the whiter a tooth is getting, especially along the gum line of a tooth, is an early sign that there's actually a decay process beginning in a child's tooth. And it's really important that if a parent sees that, they see a dental health professional as soon as they can. What parents should do on a monthly basis is actually lift the lip of their child so they can actually see all the way to the base of the gum where the tooth begins and see if they can identify any early signs of tooth decay. We're going to show you how to look at your child's teeth, and you do that by raising the child's lip. What we're going to do is we're going to have you turn her around facing you and have her legs wrapped around your waist. And then she's going to come backwards, and her head's going to rest right here. And you can actually lower her lip and looking along the gum line where the tooth meets the gum tissue and identify the bleached white area that's an early sign of tooth decay.
Seeing bright white spots would alert the mom, and this type of tooth decay at this stage can be healed, so it would be a sign to go to the dentist. Mothers have a real opportunity to prevent tooth decay, and they have the ability to take care and teach their child from day one how important it is, and to actually take some very early steps in making sure their child is cavity-free.
It's really important that moms understand good nutrition. They're taking prenatal vitamins. They're reducing their consumption of sugars and carbohydrates to reduce the risk of tooth decay. If they're not brushing their teeth twice a day with a fluoride toothpaste, they must adapt that behavior. They have to be drinking fluoridated tap water if it's available to them, and they have to be flossing once a day. It's really important to get your infant used to you in their mouth. It's important to use an infant washcloth that's wet and to apply gentle pressure along the gum pads before the teeth even erupt.
When the teeth begin to erupt, then we have the opportunity to clean those teeth. And as soon as we have a few more teeth, the mother can start using a small brush, a little bit of fluoride toothpaste, and use it to clean the child's teeth twice a day, in the morning and in the evening before bed. When the child is 1 year old, it's the time to take the child to the dentist for their first exam. One very important part through all of this time, from day one until age 1 and beyond, is to make sure that there is no sugar-containing liquids.
The more you consume sugar, the more likely you are to develop cavities, which means minimizing the use of sippy cups with juices and other sugared products in it, especially at night. It's important at nighttime that parents do not put anything in a bottle or a sippy cup other than water, because even milk, which has a low concentration of sugar, can cause a tremendous amount of tooth decay at night when the saliva turns off in everybody's mouth.
To take care of Savita's teeth, we brush her teeth in the morning and we brush her teeth at night with a fluoridated toothpaste. She doesn't go to bed with a bottle unless it has water in it. And we're watching out for those other teeth that are coming in and wiping down her gums every night before she goes to bed and when she wakes up in the morning too, so that we can keep the bacteria off her gums.
What I'm currently doing now is brush my teeth twice a day. I floss. I avoid sweets now that I'm pregnant.
When I was pregnant, I increased my flossing, my rinsing, my brushing. I also went to the dentist. I tried to go every 2 months.
When I was pregnant, I drank tap water, which also had fluoride. Brushed my teeth during breakfast and lunch and dinner, and I also floss daily. Good dental hygiene is very important, because if our teeth are not healthy, then our body's not healthy, and then it can cause, very serious dental health.
Now, we know in some places your physician, your doctor, your nurse practitioner may also participate in examining your infant's mouth, your baby's teeth, and possibly also taking steps to prevent tooth decay.
It's very common today for physicians, family physicians and pediatricians to offer a thing called fluoride varnish, which is a high concentration fluoride that is applied to the teeth of children. And this is a great tool that parents should be willing to accept to help prevent tooth decay in children.
So in addition to your dentist, your physician and your nurse practitioner are there to help you prevent tooth decay and work with what you're doing at home every day.
The most important thing to remember that tooth decay begins as soon as a tooth erupts in the mouth. And if we can actually prevent tooth decay at the earliest ages, we can have children that are tooth decay free for life. So you need to change your behaviors to be what your child's behaviors should be. And by changing what you have done for yourself, you can not only improve your child's oral health, but ultimately improve your own oral health as well. So the whole family can benefit in the long term.
We try very hard to take good care of Savita's teeth because we want her to keep all of her baby teeth until her adult teeth come in, because they are so important to keeping her mouth healthy and keeping her whole body healthy.
At this stage, early on from when the child is born, we can make sure that your children are able to have a fully healthy life and benefit from everything that life, school, and play has to offer.